So Docabo is a telehealth system which remotely monitors patients within their own home. So in this case, it monitors patients' vital signs and disease-specific conditions within the care homes. So this is the device that we use. This is called the Care Portal, and it's a multi-patient mode device where you can store information of up to 20 patients into this device. So everybody has got their own specific questions, observation prompts, and whatever they need to record on the system. The carers go around twice a week and monitor these vital signs. So they put their blood pressure, blood sugar, pulse oximetry, anything, temperature that needs to go in. And each individual have their disease-specific questions. So conditions like COPD, they'll have things like, are you coughing more than usual? Are you producing sputum? What is the colour of the sputum? Are you more breathless than usual? Things like that would all come up in that particular condition. The urine infections, that is one key area that we've noticed that a lot of the care home patients have, disease area that a lot of care home patients have. So it would be like things like, is the urine colour dark? Prompt questions for the carers to ask the residents. Are they having abdominal discomfort? Do they have burning sensation when they're passing urine? And it also prompts them, after all those particular questions during with the UTI, to actually dip the urine to go ahead and see if they have got urine infection. So if the prompt questions or the vital signs are outside the normal parameters, then I would get an alert. The system will send an alert through my mobile phone, and it will come to me via email, which other matrons can also access. And then we'll be able to ring the care home first, just to ask more about the patient, and then arrange a visit usually within 2 to 4 hours.
So as a service, we were always looking for different things we could do to improve patient care. And I went to a Kent, Surrey and Sussex event, and Docabo was being showcased there, and I thought that could help us with our admission avoidance, and that was about as far as I thought. So we got some funding, and Moynia trained the care home staff to do observations, and we wrote question sets around disease-specific conditions. And it's been going now for about 9 months. And what's come out of it is a 68% reduction in hospital admissions, a 69% reduction in 999 calls. But the best thing to come out of this is the fact that the carers are trained to such a high level now that they're able to recognise through continually doing patient observations and asking questions around diseases in patient conditions, so they can actually look at and alert us to any deviation from their normal parameters. So that means that we get an alert on the system, and that comes to us, and we're able to discuss with the home what we're going to do about it, whether that's normal for the patient or not, and then come out, assess, diagnose and treat within the day. And that's made a huge difference to how we work and the delivery of care in the care homes.
Docabo is very easy to use. My initial training was about getting the staff to be able to do the vital signs, so the skill around doing blood pressures, temperatures, pulse oximetry, and their observation, so looking at legs to see if they're red or more swollen than usual, just to get the staff confident in asking those kind of questions and getting that skill. But Docabo itself is really easy to use, and my starter line with the training is, you've all got smartphones, it's just a bigger smartphone dressed up in hard plastic, and they get it straight away. So it's got the top arrows, side, back, whatever way you want to go, and you can't go wrong with it. Apart from uploading the vital signs and the disease-specific questions, the Docabo Care Portal also has the ability to check ECGs, and it's also got a camera. So if we have instructions to give to the carers or the patients via the Care Portal, that can also be done. We can also upload management plans for the patients, the carers, to go back onto to sort of instruct them about what exactly they need to be doing.
The carers do my observations twice a week using Dockerbow. They do my blood pressure, my oxygen sats, and they do my temperature. They look at my legs because I've had cellulitis. I had a lot of pain and redness in my legs. This was shown up on Dockerbow. I phoned Monia and she came out and she looked at my legs. She said I didn't have an infection, even though I was on antibiotics for an infection. She said I had a clot. So I had to go to the hospital where they scanned me and gave me an injection. They agreed with Monia that I had a clot. I was able to come home after that and my treatment carried on in the home.
Before the Dockerbow came in, I didn't know how to observe the residents as what the Dockerbow introduces. We didn't know how to monitor a client's oxygen levels, their blood pressure, and with this Dockerbow now, I'm able to do that.
Before I was trying for Dockerbow, we have to ring for the GP, and it's hard how to reach them, and we have to wait at the end of the day before we can get a visit. Now that we are working with the matrons, the community matrons, and we've got the Dockerbow in place, we are trying to get temperature, we are trying to get oxygen sats, we're trying to get blood pressure. We input that in the machine and they picked it up before lunchtime, and we can easily communicate with them and reach them whenever we need them. Hospital admission has actually massively reduced. Calling out 999 and out of hours doctors as well has actually reduced.
We're able to check for the symptoms of a chest infection more easily, because if we saw a resident coughing, we're able to check their oxygen sats and then ask other questions about their health, and then we're able to get in contact with the matrons, and then we'll be able to pass over all the information that we've asked about, like the colour of their phlegm, the cough that they've got, and all their temperatures going up, before we had to contact the GP to get them to come in for an out of hours or in hours call. But now we just contact the matrons and they can come in within a few hours to see them.
We work alongside the matrons. Since we've had it, we've got about 18 clients now on it, and we have found it's reduced admissions to hospital greatly. Staff are trained by the matrons and we all liaise with them closely. The staff are now able to identify UTIs, somebody's got COPD, chest infections. We monitor their blood sugars with it and we enter all the information. From this, we also hand standby medication, so as soon as the matrons come in, the medication's there for them. It's reassuring for any new client moving into the home that we have this service available, as it is an extra service, especially those who are prone to infections or have serious health conditions. We have greatly taken it on board and it's really benefited the home, and working closely with the matrons has benefited, and it gives the reassurance to our residents. Before we had the Dockerbow, as a manager I was always contacting doctors, getting out visits, especially at the weekend. It could lead to hospital admissions. From this we have reduced it greatly, and the matrons are on call literally 24 hours. They come in, they pick up from the information that we have taken, and from this they will diagnose, and treatment is within less than 24 hours. And the hospital admissions, I have found, have reduced well over 50%. We've had no one go in due to COPD conditions, chest infections, urine infections for a very long time.
So because of the success of the project, there are other areas within Kent that have come out and seen Dockerbow in action and want to mainstream this project throughout other localities in Kent.